Okay, continuing on. V70 to V82 category is used when a patient without a diagnosis is suspected of or being screened for an illness, disease, or condition. This could include cancer screening, preoperative exams, as well as routine physicals. V83 to 84 is for genetic screening. A patient may not have a diagnosis, but is being screened to see if they are susceptible to or a carrier of a diagnosis that could possibly be passed on. V85 is for your body mass index, or BMI. You can code the BMI if the documentation is from a dietitian or a nurse. However, you cannot code a diagnosis of obesity unless it is documented by the physician. Estrogen receptor status is when someone has been diagnosed with breast cancer. Please always remember to code the malignant neoplasm of the breast first. V87 is for exposure to a hazardous or toxic substance like uranium, dyes, or molds, possibly in the workplace, or a patient that may have a history of taking a drug that may compromise their immune system. V88 is when you've had a surgical removal of an organ such as a kidney or a pancreas, or other tissues such as a hip or joint. V89 is specifically a screening for a pregnant mom to make sure that their unborn child doesn't have any problems. V90 would cover retained foreign bodies, such as metal, shrapnel, glass fragments, or even cactus spines. Why would this be important? Well, MRIs are one huge magnet. Having retained metal fragments within your body would contraindicate an MRI on a patient. V91 is for placental screening, usually by ultrasound, to determine number of gestations, placentas, or amniotic sacs. Aftercare and follow-up codes are often confused. The coder needs to determine the phase of the treatment status in order to get the correct code assigned. Follow-up codes are used for following a patient that has completed treatment of a diagnosis or injury and the condition would no longer exist. Here is an example of an aftercare V code. Let's say that your patient has had a hip replacement. The patient is healing. There's no apparent complications or infection. The patient's seeing the provider regularly until the condition is healed. The V code for aftercare following joint replacement is V5481. Additionally, you would use code V4364 to identify the hip joint. Okay, now we have just a few additional tips. Always refer to your coding conventions for how and when to code V codes. Some can only be used as a principal diagnosis or the first reported. Some may only be able to be used as a supplementary code or secondary diagnosis. Some may have fourth or fifth digits. Remember that you can always code as many V codes as you need in order to describe a patient's condition, especially when you feel that a V code will alert to a condition that may affect the patient treatment. V codes are most commonly used in health clinics, primary care settings, and as hospital outpatients. And last but not least, here's your link to cdc.gov. This link will take you to the external cause Z codes for ICD-10. Hope you got all that, and happy coding.